We're going to start. My name is Giulio Maria Corbelli. I come from Italy. I am a member of the European AIDS Treatment Group, but also a member of the Italian organization of LGBT people living with HIV+, which is one of the, probably the most active group in Italy promoting PrEP and trying to disseminate information about PrEP. So I'm also a journalist, so somehow maybe it is also because of that Gus asked me to moderate this session, which is about spreading the word about PrEP. And I think it is a really important point about our discussion. You can read the questions we are going to address during this session. I'm not going to read them because you have the program, so I'm not wasting time. But I really think that we are all discussing about all the issues, the cultural factors being a barrier towards access to PrEP. So I strongly feel that addressing those cultural factors, the misconception, the myths around PrEP is really important to have a successful implementation program. We are going to discuss this with three speakers, and I am inviting them to join me here on the stage so we can start the discussion. We have Alex Garner from Hornet. We have Matthew Hodson from NAM, aidsmap, and also Damon Jacobs from the PrEP Facts Facebook group, which is really important. So you have one mic here. There is another there. And I would like to start the discussion just trying to understand how we were successful so far about addressing some of the issues related to PrEP. I think that, for example, on your group, since the beginning of your group, the questions that were raised by people in the group were very different from those who are asked now. So how successful you were, or we were in the group to address all those questions, and what worked well, and what we can learn from what we have done so far.
Okay. Well, thank you, and thank you, Gus, and everybody. It's great to be here. So I started. He's going to pull up the slides. So a lot of you in this room are on Facebook. And part of this group called PrEP Facts, Rethinking HIV Prevention and Sex, and I hope the rest of you will be, because we're probably going to hit 20,000 members, global, international members, either today or tomorrow. This was started July 1st, 2013, in my living room in Brooklyn in my underwear. And it was a hot day, and partly it was a response to the fact that we had, in the US, already approved PrEP a year earlier. The FDA had approved it, but no one knew about it. Now, I had been using it since July 19th, 2011, and I still am. So I'm 6.5 years of a PrEP user. But still in the US, nobody was learning about this. And in New York City, none of our agencies, none of our organizations, our Department of Health refused to give out information about an FDA-approved way of reducing HIV by 99% or more. And I thought, how could this be? How could this happen? Now, I had been working in HIV, and I remember when I started in the field in 1991, if you were passionate and you had a message and you had a cause, you had to go through an agency, you had to go through an organization, or you had to have a lot of money to take out a newspaper ad or something. But by 2013, when people weren't learning about PrEP and nobody in New York City or the US was talking about it, I'm like, this isn't the 90s. You don't need an agency. You don't need an organization. You just need a Wi-Fi connection and a really large cup of coffee. And I probably didn't need the coffee. And I just started this group. So anybody in the world, anyone who wants to learn about PrEP, who has access to Wi-Fi, who has access to Facebook, could learn the science, the fact, the data, the information, and get community-based support and information about using PrEP. Much to my surprise, this thing took off. It became very big, very quickly, and now we almost have 20,000 people. And after the rest of you join, we probably will have 20,000 people. So in the beginning, 4.5 years ago, the questions in the US were, I mean, they were very basic because we didn't have any information, and the only information that was available on the internet was information that had been perpetuated by a certain person in a certain well-known organization who was using the internet and media to spread lies and mistruth about PrEP. And that's all that was out there. That and the stigma of the Truvada whore, the thing that had gone viral. So the questions were very basic. What is PrEP? How effective is it? Are my kidneys going to rot if I take this? Do I have to use condoms? What happens when I communicate? And back then in the US, if people did tell people they were using PrEP, they would often get a lot of stigma and shame. So people would post pictures of their conversations on Grindr, usually just Grindr, where they would say they're on PrEP and somebody would respond and say horrible, horrible things. So we would often try to help them through that. Now I think in the US we have more understanding about PrEP, but a lot of it is still misunderstanding. And I think a lot of people, a lot of the consumers and the patients are often more informed than their doctors, because we hear a lot of stories about people going to their doctor or to their local clinic trying to get PrEP and being told very, very, very incorrect or wrong or totally messed up information that's not true, and we help them deal with that. Now that we're seeing PrEP get more talked about in Europe, now that we're seeing more of it widespread here, we're slowly seeing people more and more from Europe joining our group, but often coming with the same questions that people were just learning about 4 years ago, and worse, dealing with the same kind of stigma. So quite frequently, there was a whole bunch of posts just in the last few months of people from Berlin, people who are learning about PrEP, understanding about PrEP, talking about PrEP, and getting the same Truvada whore, finger-pointing, hateful stigma from their friends, from their potential sex partners. And so that's where I think we're at. When you start to introduce PrEP into a community, there's this initial like, whoa, no, we can't do that. And then people's minds do start to change over time, but it does take time. And I think we're seeing that unfold in Europe right now, much the way we did in the US 4.5 years ago.
Yeah, I can understand. I think that in the gay community in general, there are still some misconception about PrEP. And I know, for example, that you, Alex, your website, Hornet, has been involved in many also surveys about use of PrEP or conception and knowledge about PrEP, also in Europe with the ECDC. So can you tell us something about what is the reality in the broader gay community, where maybe people are not that informed like the people sitting in this room now?
Thank you. Yes, sure. So, excuse me. Once again, I'm Alex Garner from Hornet, the app and the web platform. We were really fortunate to be able to work in collaboration with European CDC 2 years in a row to conduct a European PrEP survey. And some of the information that we gained from that survey helped us understand gay men's experience in Europe around PrEP. We did it in about 7 or 8 different languages. We covered all of Europe. We had really great representation from places like Russia and Ukraine, so that was always great. But I think one of the key things was whether or not gay men knew what PrEP was, and there was a high level of knowledge around PrEP. But it was a question of whether or not they planned to take it in the next 6 months. And one of the other, which we saw at least 30 to 40% were likely to take it. And I think one of the key things that we asked them, one question that interested me the most, was we asked them if they were happy with their sex lives. And about 40% of them were happy with their sex lives. And a high number of people who were currently on PrEP were very happy with their sex lives. So it was a sort of nice window into the satisfaction gay men had with their sex lives, and particularly those that were taking PrEP. And the reason that I wanted to mention that is because I think one of the key things that I find interesting about this entire past 2 days is that we're talking about PrEP, but I actually haven't heard a lot of talk about sex and fucking. And that's ultimately what PrEP is about, right? And so I think we've done a really good job of having the clinical discussion about PrEP, but when it comes to this sort of nitty-gritty gay men wanting to fuck, we still have a lot of work to do around that. So I think that's one of the things I wanted to mention, sort of challenge all of us in this room and all of us who can't be in this room to really highlight the priority of sexuality in our conversation about PrEP.
Yeah. Now to you, Alex, please. Matthew, sorry. You don't have a presentation, do you? No, that's good. Because you are managing one of the most important source for HIV, information about HIV in Europe and probably worldwide. I would say worldwide. So this is an example of how the HIV community, also the community of people living with HIV, has been leading the discussion on PrEP. Could you find some different patterns around this kind of information? I try to clarify what I mean. I feel that talking about HIV from a journalistic point of view sometimes can be quite difficult for non-expert readers, just because it is hard at this moment to find the news, the breaking news, something really appealing for the reader. So PrEP was something really revolutionary, was and still is something really revolutionary. So I guess that this helped conveying some information into a broader community. What is your perception from a media manager from this point of view?
Good God. I think one of the things that I find really interesting about where we're at with PrEP now is that we are really just at the very beginning of the journey. I mean, if you look at the example of the United States, where it's been available since 2012, actually of the people who are sort of eligible for PrEP, as in terms of their risk and their likelihood of acquisition of HIV, we're still only looking at 12% of people who fit that category, who are actually taking PrEP. So the potential for PrEP to expand is still huge. We're not close to being that across Europe, mainly because we don't have the same systems in place. And I'm not bigging up the US healthcare system because I mean, if you look at the proportion of people who are undetectable on treatment in the US certainly compared to the UK, I mean, UK is doing much, much better than the US. So the US healthcare system is not good, but they have been doing PrEP for longer than us, and it's still not reaching everyone. So we need to talk about it. It's interesting, there was a slide which Greg was going to put into his presentation, and then he gave it to me, and then I haven't done anything with it. But looking at the traffic to I Want PrEP Now, and it peaks at the times when there is news discussion about PrEP. So there's this bizarre thing, Youssef talked about it yesterday, the High Court trial that we had about the NHS's decision not to move forward with PrEP. And actually that was, in a lot of respects, the most positive thing to happen to PrEP rollout in the UK, because suddenly everyone was talking about it. It was on the front page of the newspapers, everyone was doing radio and TV, and the amount of hits to I Want PrEP Now. Well, it's not really big enough for me to show you everyone, but but maybe Gregor doesn't run around and show everyone. But I mean, that's how you get the messages out. You have to talk about, make it news. So proselytize, don't advertise.
Can I add something? Sure. So I absolutely agree. I mean, I think that at Hornet, not only are we an app where guys can meet, but we also develop our own editorial content. And so it's been really important for us to be able to represent the stories and experiences, particularly of gay men around the world who are taking PrEP. It's really been critical to be able to provide that perspective. I actually have a slide back there. Do you guys have a slide for me?
Who's managing the slides? It's coming.
Oh, there it goes. There we go. So you'll notice that we're wearing the same T-shirt. So I'm mentioning this. This is actually from Brazil. So I have this T-shirt on that says in English, I want my PrEP. We developed a PrEP education campaign in Brazil, specifically around men that are using Hornet or that are part of our audience. And I wanted to mention this person in particular and show this image to sort of communicate the story attached to it. So basically, this guy, his name's Arthur. He's 24 years old. He's a PrEP user. He's in Brazil. He's black, obviously. And I gave him one of our T-shirts and asked him to, if I give you a T-shirt, you're going to have to, take a picture and share it on social media. And so not only did he share it on social media, but he put it in his PrEP profile. In his profile, you'll see on Hornet, you can select if you're negative and on PrEP. He did that. And he was really enthusiastic about being able to communicate to other people through the app and online that he was a PrEP user. And I think this becomes the sort of critical juncture that we're at in terms of PrEP issues, whether it's in Europe or globally, is that if we can get representation of more people like this, who are willing to put it in their profile, or willing to have conversations on apps like ours about their PrEP use, we saw how successful that was in the US. And I think from a European standpoint, we can see it happen here on social networking apps like ours and others. And I think all of us have to challenge ourselves to figure out how can we make more of these conversations happen, and how can we get more people who are willing to put PrEP in their profile, who are willing to put HIV positive in their profile, and who are willing to stand up or raise their hand and say that they're a PrEP user. And I actually, when I would deliver sort of PrEP education courses in the US, one of the questions I would always ask, and I'll ask it here and hopefully no one's offended by it, but can I get a show of hands of people who are actually taking PrEP in the room? So that's a okay representation, but we can certainly do better, right? And we can certainly do better in terms of hearing from every single one of those persons who raised their hand, because I don't think I've heard from all of you. So I think it's critical that not only can we represent people represent themselves and their PrEP use virtually, but also face-to-face and in person in terms of their experience.
And I think what you've seen, and what I hope we'll continue to see with PrEP messaging, is that there's often a playfulness to it. There's often a fun to it. A lot of people that are making the shirts that I've been wearing here the last 2 days, and the shirts that Greg and so many of us are wearing, are made just by people. They're not necessarily shirt makers or doctors or nurses, but they're just individuals who have risen up to say, this is something I want to contribute. This is something interesting. This is something I want to be. We were talking, Phil and I were talking, how so many people in this room, and so many people not in this room, who have been central to education, are people that don't work necessarily in HIV, or people that don't come from a medical background. We're lawyers, we're real estate agents, we're sex workers, we're therapists, we're people who work in fashion industry, but people who just saw, here's a need, here's something I want to be a part of, I want to make it fun, I want to make it celebratory, I want to make it sexy. And I think when you get consumer buy-in like that, there's a lot of people then who want to be like, yes, they want to wear the shirts on social media. And they're really excited and enthusiastic to share this with their friends. I've been working in this field for 28 years, and I've never seen this level of buy-in and engagement and passion from consumers before.
I would like to... You want to say something?
Yeah.
Okay.
I mean, just kind of a little bit about this particular summit is we wanted it to be bigger at first. We wanted to have like 500 people and have people from pharmaceutical companies and all of that, and just have enormous meeting, a bit like the one which was in America last year. And then we didn't have the budget. We had to make it small. And we said, well, who's the most important group to reach out to? And what I'm really happy about is I look out and I see activists and I see community people, and I think that's what's really powerful, and I think that's what's been hugely powerful about the whole PrEP movement, is that it has been people like Damon and like people like Greg who've kind of got out there and said, we're just going to make this happen. And this is when health promotion excites me, and this is the health promotion that got me, this is what got me into health promotion in the first place. And it's a great expression because it fits what we're talking about, which is sex. It's a bottom-up approach.
Yeah, that's right. Yeah, I just want to make a comment on this discussion, which is, for me, is very central. And then please feel free to raise your hand for questions or to stay online. We were discussing earlier this morning with Martin also I cannot see him, but he's around somewhere, about the issue, the question he raised about stigma and how to address stigma. So your example, this example, and those you are referring to, shows that visibility of people directly involved in something which can be controversial for other people is really crucial to address the stigma and to try to solve that issue. I have the feeling, maybe you can confirm or not, or also your experience is that all the controversies at the very beginning of PrEP and the PrEP war stuff and things like that were solved by the visibility and the very quiet and proud, I would like to say, visibility of people saying, okay, I'm a PrEP war, what's wrong with it? I live my sexuality in a positive way, and I can do that even in this environment where cultural factor would like to put me in a corner and blame on me. But this is really crucial. And I think that we as journalists and people managing or being active in social media have a role to play in this. Using the communication tools to bring on the front the visibility of people who are directly involved, I think is really crucial.
Well, just to add very quickly to that, I think that part of the issue around PrEP and HIV and prevention and sexual health is that we don't talk enough about the value of sex without condoms. That should be the starting point. And usually it's the one thing we don't talk about. And so if we had that conversation all the time, consistently, whether it's around stigma, whether it's around sexual health, whether it's around HIV, STIs, this conversation would look radically different. And so integrating sex and pleasure and intimacy into our conversations consistently, particularly when we talk to the media, is something that can help us move in the direction that we need to go in.
Yes.
So you've mentioned animosity towards PrEP users online. I'd like to say I've been seeing that too in Germany, and I find the more violent comments come from people saying, we're putting everyone at risk because of resistances. They point to the last 2 cases of PrEP failure, and they say it's just a matter of time before Truvada isn't effective at all anymore, not for treatment and not for prevention, and we're going to ruin everything for everyone. So what we need right now from HIV specialists is a clear statement on why resistances in HIV do not work like in bacteria, why it's very unlikely that, that such double resistance to TDF and FTC will spread like wildfire among PrEP users, and which safeguards are in place to prevent such a scenario from happening. That's something that we activists cannot say and be convincing. We need HIV specialists to say that and be clear about it. So that's one thing. Now, about the subject of this session, spreading the word, unfortunately, I see on stage 3 white gay men, and we were talking about how to spread it to other populations. So I'd like to offer some different ideas. First of all, there's something that we could do through pharmacists, which is every time someone comes to buy some pregnancy tests or contraceptives, give them a leaflet about PrEP and say, we're having a new campaign, perhaps this could be relevant for someone you know, for your cousin, your daughter, your sister. Then I think we could use allies. We have gay allies in some key places where women spend a lot of time. For example, hairdressers. Why not really, HIV organizations could contact hairdressers, give them posters to put in their stores, and if the woman actually speaks about it, then there's a gay guy cutting her hair who can explain what PrEP is. Yes? We could, we have other allies who are editors of fashion magazines. We could have a little tidbit about PrEP in Elle, in Marie Claire, in Vogue. Those are things I think are a bit untapped. And then if we're talking about young ladies, we've been using social media wrong, I think. Young ladies learn most of their makeup skills through YouTube. There are YouTube makeup stars that have millions of views. Some of them are drag queens, by the way, who we could contact and perhaps give some money to do 30 seconds about PrEP. The same thing for trans men. I think there are some key trans men that are very visible online. One that I can think of is Adrian Dowling, who is very vocal and very inspiring. So perhaps we could contact him and make him talk about PrEP. There are some Instagram stars. There are many people who already have a platform and listeners. I think we should contact those people and make them speak for us. Thank you.
Can I respond to some of that? Sorry, great points, great points. And obviously we need to get the word out. I would just say if we're talking about reaching trans communities, if we're talking about reaching black communities, then let's employ trans people, let's employ black people, because this is not just about asking favors. This is about making the resources available that this work can happen. It's peer education that works, but we shouldn't be expecting people just to do it just because they care. Give them the money to do it. There was another thing which I also wanted to say, which is on the earlier thing about use of social media and how we get attacked. We talk about the amazing work that people like Damon, that people like Greg have done using Wi-Fi and a cup of coffee to reach people. We recognized that the people who oppose us, who think that we're wrong and sick and disordered, have the same access to the same tools. They have good Wi-Fi. They have a lot of coffee. Since I have been sitting here today, I had someone come up to me, kind of approach me via Twitter and say, what about all those people living with HIV who are selling their HIV treatment to people for them to use it as PrEP and then becoming detectable so they can infect their sexual partners? Or are you too politically correct to comment on that? So I replied, I'd be really interested to see your evidence for this. They said, you can't handle the fact I want to wipe that fucking smile off your face, and then blocked me. Cunt.
Okay. I think in terms of global platforms, just to brag a little bit, Hornet has over 25 million users. So we are a global platform that is heavily invested in the health of gay men, and PrEP is one of those things that we are strongly committed to. And we're a gay platform. Gay, bi, men who have sex with men. And as an American and as a Latino, there's might be 3 white faces up here, but I do represent my Latino heritage on the stage. And in the US in particular, and we know globally that gay men are still the most disproportionately impacted by this epidemic. And we've struggled just to have representation of funding for gay men in the US when we're over 70% of infections. So I will never apologize for that. I will always fight for and demand that we invest fully in gay men because we haven't gotten there yet. And in particular, we're talking about gay men of color and young gay men of color. And we haven't seen that, and we haven't seen the representation of that. But it's something that I personally have always been fully committed to, and as a company, we're very committed to. And I think as a community, we have to make it a priority. We have to make black and brown queer lives a priority the same way that we have to make trans lives a priority. And we haven't been able to do that. And I think it's a challenge that all of us have to rise to if we want to see beyond an epidemic and beyond HIV. It's about whether or not our community can have full equality and whether they can be healthy.
Next question.
First of all, thank you for the websites, for the Facebook pages. I do appreciate and admire the patience which you have when people completely ignore the frequently asked questions. And nothing beats learning from a case study. What we get on the Facebook is actually a case study after case study. And that gets more to the audience than a paper from a journal. The point I wanted to make is a few weeks ago, I attended an HIV literary event at the University of Manchester, organized by 3 students reading a PhD in HIV and something else. And the first session was about community, whether PrEP users are finding a community in the sense of people living with HIV have found over the years. Nowadays, everything is being done online. There is a sense of community online. But is that replacing or making up for the sense of community people might feel physically like people living with HIV? So we have communities of people living with HIV, but we don't have that physical community for people who take PrEP. Is social media enough? I just want to go back to them with some answers, that's why. Is social media enough? And if it's not enough, what can we do to have this sense of community and a sociological aspect for PrEP users?
Okay, great question. Thank you. Thank you so much, and thank you for the great comments about the Facebook group. So, so you know I'm a big proponent of social media. I think social media is great. I didn't grow up with this. I didn't come of age with this. This is new. So this, I think, is great. And the reason why I think it's so great is because it equalizes the playing field. It takes away the privilege of power out of the people who hold it, traditionally the agencies, the organizations, the news media, and now it gives it to the people, to the consumers who want it and need it the most. So it's still not like everybody in the world has access to Wi-Fi, but for anyone who does, and for anyone who can get on Facebook, they could go to the frequently asked questions, because that's a public page, and then the closed group is anyone can join, and they can get this information. So it's not being held in the echelons of privilege anymore, the way it used to be. And I think that's a really important point, and this is why we've seen PrEP unfold the way we have, both in the US and now in Europe. However, it's always a good question. Does social media replace physical communities or events like this where we get to see each other and talk to each other and listen to each other? Hell no. No, these events are so important. But if you approach, I always say social media is completely neutral. If you approach it from a place of feeling separate, alienated, lonely, you will reinforce that by the experience you have on social media. If you experience life as abundant and loving and fun and playful, and you go to social media looking to reflect that, you will see that reflected as well. So it can be used either way, but that comes from our minds and from our hearts.
And just to quickly add to that, I think that community has evolved and it's expanded. So it's not just face-to-face, it's virtual, and I think social networking apps like ours and Facebook and Twitter and others allow, you can go on Hornet, you can find someone in Brazil, you can chat with him about the fact that he's on PrEP. Whenever I go to a city and I'm positive and it's in my profile, I will frequently get guys who will ask me questions about HIV. And so I think it has expanded the sense of community and allows us to have communications with people we never thought we'd be able to talk to all the way around the world, and that only makes our experience with each other and those connections all that better.
Yes, yeah. Just some thoughts of my own. In terms of the PrEP for women, I think it's a very difficult question. Not so much for trans women, because I think there you have a focused and reachable community, and I think although, we may be a very long way, I think there are promising signs that we are starting to reach that community. But heterosexual cis women, it's a much more difficult problem because they're so the ones who are at risk are so much more sort of diluted throughout the community. So how do you do that? I really do like the idea of leaving PrEP information at pregnancy advisory clinics and things like that, because those, and we've got studies that show it, are the kind of women who are likely to be more at risk of PrEP. But it is a problem with healthcare workers because I think it's only HIV doctors who actually like talking, or most, this is a gross generalisation, but a lot of doctors hate talking to their patients about sex, which is interesting considering they deal with the most disgusting things about your body every day, and yet they hate talking to patients about sex. And I know my hubby is a doctor. I know what he's like. And he's quite relatively matter-of-fact about it. And it's partially a terror of saying the wrong thing or being seen to be insensitive or asking the wrong question. And it's also partially just not wanting to know because, you know, they think suddenly they'll have to become a counsellor or something like that. And so I think I was very inspired by Yanis's story about the five, you know, you need the five key healthcare workers. And I think what we now need to do as PrEP in Europe is reach out much more strongly to EX, to the European doctors, to the ones who are here, and thank you for being here, but also the ones who are not here, both the ones who wanted to be here and couldn't help it, but the ones who aren't. And there are brilliant doctors out there, and there are doctors in Europe who have been working with patients who come to them saying, I'm taking PrEP in relatively hostile countries like Poland, and they've been doing it for a couple of years, and they haven't been telling anybody. And we need to know their stories and how they reach out to people. And in terms of how you deal with the myths that are out there, well, I think it's difficult because, on the one hand, for one audience, you want to be sort of gentle and non-confrontational, but in other areas where being confrontational is the only thing that bloody well works, and look at the lesson of U equals U, they wound people up dreadfully, but they got people to sign on to a very simple statement. And I think if we were able to tackle some of the myths around PrEP, such as it will give you resistance, you know, it won't. We know why it won't. We know that's going to be a rare thing. You know, not never, but it's going to be rare. Then perhaps we can formulate some of those as campaigning statements similar to U equals U, saying, you know, this is how often it fails, i.e. hardly never. Hardly ever. You know, if we can do a few sort of focused campaigns about statements about PrEP, that would be great. That's just a few thoughts I have.
Thank you, Gus. Just to note that we have 4 people online and we have 10 minutes, so let's try to...
I was just kind of wanted to just very quickly pick up on one thing, and that is this, you know, we talk about the way we are criticised, and actually a lot of that is about HIV, and HIV prevention has often been used as a form of social control, and actually, that means that a lot of the discussion about HIV has not been honest, and that's why PrEP is such a threat, and that's why U equals U is such a threat.
Well, I actually wanted to ask you about that, because I hear a lot of suggestions and tips about what we should do. Is there anybody who wants on the panel, maybe who wants to share experiences about what not to do when communicating about PrEP? And the reason why I'm asking this question is exactly because of what you say. I went on national television in Holland, and I went on one of the biggest newspapers in Belgium talking about PrEP, and I talk from my personal experience. I don't like to use condoms, so PrEP is a solution for me. But the only message that was communicated on the news and in the newspaper was PrEP is about sex without condoms. While actually the message I wanted to give is PrEP is about sex without fear, which is a much more positive message. So my tip to people or groups who want to get active with media is devise your media strategy and make sure that you have your message, which you want to send out, clear in your head whenever you give an interview. But maybe other people have experiences with things that didn't work or worked out differently than they had intended.
I guess I mean, to your point, don't lie. I think it's crucial that we tell the truth, and prevention hasn't always done that. And don't stigmatize. When it becomes an issue of making someone afraid or blaming someone or bringing in a notion of who's responsible, then automatically it takes the conversation in the wrong direction. So I think speaking from your own experience, from a positive standpoint, and telling the truth, and not framing it around those things really helps significantly.
Yeah, I would agree that it's really good to plan out what it is you want to say and how you want to say it. Maybe think about your key points. We recognize that when you give interviews to the media, and particularly the print media, when it's not live or anything like that, they may misrepresent you. And this is one of the great things of social media, is you actually have the opportunity to put it in your own words.
And thank you for the question. I am a really big proponent of not using the word should when I teach or when I train. And part of that is because I am a white gay man in his 40s. So if I'm speaking with someone of a different age, gender, background, there can be a discrepancy. So if I'm saying you should do this, how is that going to land? Like, how is that person going to receive it? Probably like talk to the hand. And I feel like I learned this the hard way from working in organizations in the 90s, because we would run around and we'd run around San Francisco and we'd tell people, you should use condoms, you should use condoms. And what that did was extinguish the possibility to have a conversation for people who were not using condoms and were scared and wanted to talk about that and think about risk reduction. We extinguished the possibility to have those conversations because we were coming from this prescriptive, top-down, should model. And I see that still happening now in the US in terms of why a lot of young people and young people of color are really not engaged or interested in PrEP, and partly might be because they've heard this message from someone saying, this is what you should do. I know better about your body than you do. So that is probably the hardest learned message I've learned in the years I've been doing this. And then the media stuff you said, it's like, yeah, sometimes you just got to let go, let God. You can't really control that shit. But
let me add just a little question about this. What's the role of provocation, of provocative messages in this? Because according to what you say, everything seems to be should be very friendly, but trying to provoke some reaction is always. I'm thinking about the Swallow This campaign, for example.
Well, and I think provocative is a relative term. I love the Swallow This campaign, but that term for me isn't provocative. So I'm just honest. I just say, be honest, be authentic with who you are. Speak your truth. You mentioned Bruce Richmond, who also started the U equals U campaign in his, I don't know if he was in his underwear, but he started in Brooklyn. Another example of someone who came from a different background, who created this movement, this worldwide movement, based on his passion and being provocative, being confrontational, but also being very authentic and true to who he is. So when I talk about PrEP and I like to say fucking and I like to talk about semen and cum loads, I'm not saying that to be provocative. I'm saying that because it's my truth. And sometimes I modify it in some groups, but I think that's all we can do, you know? I'm not setting out to be provocative, just honest.
And I would just say that there is no magic bullet. There's no single message which is going to work for all communities. So, let's look at different messages for different communities. And if one message doesn't hit or offend one community, fine, get over it. We'll move on.
Good. Next question, please.
Hi, this is Diogo from the Lisbon Checkpoint in Portugal again. I really enjoyed, Matthew, your story about the troll Taliban from the morning. Before making the switch and working on HIV and MSM health, I used to work in vaccination for quite a long time at the European level. And as we saw with the prior session today, I think we should learn some lessons from other areas, including vaccination. People dealing with media and vaccination have long known that you do not address anti-vaxxers. You address vaccination hesitancy, because it's not effective, it's not cost effective to address anti-vaxxers. Also because even though they are the noisiest and they do have an impact, they are a very small group of people whose minds you are very unlikely to change. You address the vaccination hesitant, because those are the people you can win over. And eventually, there will be so many people that are pro-vaccination, or in this case, pro-PrEP, that the anti-vaxxers or anti-preppers will be dancing in a very empty club, and no one likes to dance in empty clubs. So I would just like to stimulate everyone to just ignore the anti-preppers and address the PrEP hesitant people, because those are the people that matter. Thank you.
Thanks.
One thing really quick. I agree with that, but I do want to say from my experience, especially with PrEP, I can't always tell. People who are anti-PrEP at one point can often shift when you have a face-to-face conversation. Online media, I agree, you can't deal with that. But in face-to-face, when I can have a genuine heart-to-heart, eye-to-eye conversation, people who are anti-PrEP have moved more to the center.
3 really, really quick points. I totally agree with you, Matthew. Pay us, but there isn't always money available. Incentivize. Find ways to get that young man and his friend on board. You can't always give them cash. Maybe it is t-shirts. Maybe it's entry to the club. Maybe it's whatever it is. That's one way to do it. 2, social media is amazing. Use it all the time. Love it. Grindr, the apps are one thing, but also let's also bear in mind that there can also be barriers. So I'm just conscious of some of the groups that I'm in online for black gay men, for queer men of colour, and I will post stuff about PrEP all of the time. around sexual health, men won't engage because for them it might be out in their PrEP use, out in their HIV status. So again, maybe you want to wrap it up around a Beyonce post. Sometimes that gets more likes. And then finally, just sticking up what you were saying about young queer men of colour in the US, we know that if it was Brandon in Ohio who was being impacted on this, the white gays would be up in arms and would be fighting in the same way that they fought for gay marriage. So we know what that's about. So kind of let's try and turn that on its head as well.
Thank you. Next question.
So a comment first and then a question. It was really good to hear from the audience as well as the speakers some discussion around women, but just a reminder and an urge to remember how diverse women are. Not all women are heterosexual. Lots of women aren't. In the UK, our data says that all women living with HIV are heterosexual. It's not true. We just don't ask the question. Not all women are pregnant. Most women aren't. Most women spend most of their lives not being pregnant. So while pregnancy services and abortion services are one space, that's one space for one time in some women's lives. And we really need to start thinking much more broadly. Gus made a really good point. There is no community of women. We're the majority of the population, actually. And so we can't just take what has worked and recreate it, but the funded HIV organisations, which the women's organisations often aren't, need to start working with us and thinking much, much more creatively about what will work.
Thank you. Can you take the last question or comment, and then we have the last one?
It's a question which came from Timo Nouri from the ECDC, and he confirms that they have been working with you, Alex, with Hornet, and the question goes to Damon whether you would be willing to roll out, together with the ECDC, with the European Centre for Disease Control and Prevention, a global PrEP survey, because they would be happy to collaborate with you on that.
Yeah, sure.
Okay,
I'm easy to find.
I
Google.
will enter the answer here.
Yes. Email me.
He's watching online, so that's good. Yeah.
And Tamar actually probably already knows this, but we conducted this survey with ECDC. We've since adapted that same survey to Brazil and Taiwan, and we'll be doing it in Mexico. So we have a great deal of data in terms of our community of users and their PrEP experience. It varies, particularly when we're talking about someplace like Brazil, where PrEP is very, very new, someplace like Taiwan, where PrEP access is extremely difficult. But we're able to glean some really, really good, useful information. And I think I would urge everyone to sort of think about how to be able to report on the experience of gay men around PrEP can really help shift the conversation as well.
I would like to have a very final and quick round of comments about the final question. How do we use this summit? What do we do, starting from tomorrow, to develop our work on PrEP using the content of this summit?
Great. Well, that's actually, thank you. So, of course, we've all seen here in the last 2 days, there's no one right answer, right? There's no capital A answer. I think we all have to ask ourselves, how can I work a little harder? Earlier today, Greg Owen mentioned the list of countries that have their own Facebook group or their own separate Facebook group where they talk about issues specific to the region. But if you live in an area that isn't being represented right now in social media or Facebook, please start one. It's really easy. You just need a Wi-Fi connection and a large cup of coffee. Just start a group. Just put it out there. I'll join it. I'll push it in my group. But it's an opportunity to build that social media community and talk about the specific regional issues, the barriers, the resources, the support. And so many of you in this room have already done that, but I think some of you were asking me in the last couple of days what you can do. Just go to Facebook and do it. And you know, keep talking about this and coming to summits like this where we support each other and give each other that real life energy, where we say, good work, you're amazing, you're doing such good stuff, but let's try harder.
Thank you.
Thank you, yes. I think one of the things that has kind of been a bit of a recurring theme of this is people getting up on stage and doing a presentation and thanking somebody else who's in the audience for inspiring them, for providing work which they have then been able to pick up and run with. In the UK, when the High Court action happened over the NHS, all of the LGBT organisations, all the HIV support organisations, all the HIV prevention organisations pretty much got together and said, we are going to be united for PrEP. And that was the first time in my 20 years in working in HIV that all the organisations were actually preaching from the same book and saying, we will collaborate, we will cooperate, and we will have a louder and a larger voice as a result of that. And I think that's what's really inspiring about things like this. And so that would be my message. Look at opportunities to collaborate, look at opportunities to cooperate, look at sharing, look at investing, and look at empowering each other.
Thank you.
Two things. One would be to speak out and stand out. And so every single person in this room can be a PrEP ambassador around this issue in person and on social media. And we'll never have enough of that, so everyone can go here and do that and double their efforts and have their friends do it, and we know it can build momentum and expand the conversation. And then the other thing, I think we need to be able to expand how we think about PrEP in general in terms of health and social justice. So for some communities, there are bigger priorities than PrEP. We may not all be happy with that, but the fact of the matter is that PrEP may not be the top priority. And we will never succeed in combating HIV or prevention as long as there are laws on the book that criminalize LGBT people. And so we have to also focus on, if we're talking about globally or in Europe, if there are policies in place that criminalize us, then access to PrEP is not going to be an easy thing. So we have to be able to expand our conversation about PrEP so that it's not just about access to one little pill, but it's a larger notion of what it means to be free, be equal, and to enjoy the benefits of social justice and human rights that we often forget about as we talk about a clinical approach.
Thank you very much. I would like to thank all the panelists here. Yes, please. Please. Thank you.